President of the Cook County Board of Commissioners.
Good morning, everybody. I'm grateful to see so many of you in the room today. I want to thank you for joining us as we gather for the first ever Cook County Behavioral Health Summit. Before we get started, I'd like to acknowledge some of the elected officials and community leaders who have joined us today, both virtually and in person. Governor J.B. Pritzker, I tell you what, let's hold our applause till the end. It'll save time. Mayor Brandon Johnson, Regional Director of U.S. Health and Human Services Mike Cabinargi, Cook County Commissioner Dennis Deere, members of the Cook County Board of Commissioners, leaders from the City of Chicago and other elected officials, and partners from across the county. Could I ask all the elected officials to stand, please, so we can acknowledge them? I'd also like to acknowledge our entire Cook County Health team, led by Interim CEO Eric Makaitis. Dr. Makaitis, thank you. And Peter O'Brien and the Kennedy Forum, who've worked very closely with us to make this happen as well. I'm thrilled to see so much interest and so many people here to discuss the future of our regional behavioral health delivery system. It's going to take all of us working together to build a better delivery system of care for the people of Cook County. And while it won't be easy, our success, starting here today, will have a significant impact on our residents, on our healthcare system, on our criminal justice system, on our economy, on the well-being of everyone in Cook County. Mental illness knows no bounds. The impact is far-reaching. About 1 in 5 adults in the U.S. experienced mental illness in 2021, and nearly 17% of youth ages 6 to 17 have experienced a mental health disorder of some sort. There isn't any family in our country that isn't touched by behavioral health issues. This issue is intersectional. About 2 million times each year, people with serious mental illness are booked into jails in this country, with about 2 in 5 people who are incarcerated having a history of mental illness. So 40% of the people in our prisons have behavioral health issues. Meanwhile, a recent study in Lancet said that in total, poor mental health and the effects of reduced productivity and health costs was estimated to have cost the world economy approximately $2.5 trillion in 2010. $2.5 trillion. And that cost is projected to be $6 trillion by 2030. We need to ensure the residents of Cook County, all of the residents, have access to the care they need, when they need it, and in a manner that's most accessible to them. Because for far too many individuals, treatment barriers exist. The numbers are clear. When it comes to annual treatment rates among U.S. adults with mental illness, only 40% of African Americans, 36% of Hispanic individuals, and less than 26% of Asians receive the help that they need. So there are racial disparities. Not surprising, given the country we live in. That's why we're here today. Our charge at this summit is to identify opportunities to improve access and delivery of behavioral health services to all. We're here to find ways to eliminate the negative connotations, the stigma that for too long have been associated with mental and behavioral health care. Whether it's geographic barriers, social stigmas, costs that prevent people from getting the care they need, we need to continue to work to break down these hurdles and make care available to every person who needs it. and however they require it. I want to thank each and every one of you for the good work that you do in our communities in Cook County every day. Thank you.
Please welcome to the stage the Honorable Brandon Johnson, Mayor of the City of Chicago.
Thank you so much. And as Madam President was sitting down, I said that she had theme music and I was waiting on mine. So, like, look, my dreams get to come true as well. But thank you very much, President Preckwinkle, for your leadership. I'm so proud that the both of us are in a position to bring the city and the county together in a collaborative way. Doesn't that feel good, you all? Yes. That's why I will always say you have to put more social studies teachers in charge of government. Right. But it really is an honor to be here for the very first ever Cook County Behavioral Health Summit and to demonstrate our collective commitment to the well-being of every single resident in our great city and our county. We have witnessed firsthand the transformative power of collaboration between local municipalities as well as counties. Most recently, we witnessed the power during COVID-19 when we had to come together for a once-in-a-century collaborative effort to safeguard the health and well-being of everyone. When the pandemic began, our region did not have the infrastructure or the healthcare staffing nor resources to fully combat this crisis. But it was only by working together could the city and county expand hospital capacity, stand up shelter for the unhoused and displaced, feed and financially assist our families, connect our children to e-learning, conduct outreach to inform and connect our diverse neighborhoods, and to ensure that people are safe and healthy. When the vaccine arrived, our region remained focused on equity and protected the people and communities who have been historically disinvested in. If we can overcome a once-in-a-century pandemic together, we can overcome anything together. We have met yet another public health crisis that we must confront. A crisis of inequity and disparities inhibiting our residents' access to behavioral health. It is a crisis that a person's zip code determines a person's access to health care. And it is a crisis that the south and west side neighborhoods of Chicago have far, far fewer mental health clinics compared to other neighborhoods. Many of you know that there is a very personal connection that I have to this crisis because all of you have had firsthand experiences to have family members struggle with substance abuse and their mental health. And I know that having accessible support is the difference maker. And there is a clear and persistent need for behavioral health access in our neighborhoods, and there is no vaccine for this crisis. So we must fully commit to the strategies and investments that actually work. My administration's vision includes strategies like treatment, not trauma, building towards a 24-hour crisis response for mental health-related emergencies, which diverts police resources away from these emergencies. We also need to have real investments in city-operated mental health clinics throughout all of our neighborhoods, especially in our disadvantaged neighborhoods. We must ensure that these clinics are high quality and physically accessible and affordable. The system that exists today, unfortunately, breeds the systemic inequities that we are all here to transform. It's been this way for decades. It's going to take time. It's going to take time and hard work to dismantle this system. And I know politicians and elected officials were acknowledged earlier, but I'm glad that the Alderman of the 28th Ward, who was a part of this fight, Alderman Jason Irvin, thank you for being here as well. they got to clap. So y'all got to clap for my brother from the west side, man. I got you. He don't went on, he put on a full three-piece suit today. Y'all gonna clap for my brother. But I'm optimistic, I really am. I'm optimistic because I believe we can achieve a healthier, brighter, safer future for the people of Chicago and Cook County because we're all here today taking this step towards the future. Our commitment to accessible behavioral health care is on full display today, with all of you engaging in this forum. Together, we will identify strategies and partnerships and expanding access and enhancing systems of quality while also resolving behavioral health inequities across our systems of care. Together, we will build a regional care system that leaves no one behind. In this effort, let us be innovative and adaptable. We have to be flexible and nimble to address this crisis. And most importantly, let us listen to one another, especially residents who are deeply impacted by this crisis. The challenges we face are dynamic and multifaceted, so our response must be equally dynamic. And whether it's addressing the mental health needs of youth or seniors, creating culturally responsive care, or expanding our network of care, we must be compassionate and determined to overcome any obstacle that is in front of us, because it is a matter of life and death. And finally, do not forget that we have overcome great public health crises before. Through our continued spirit of collaboration, we can realize our big and bold visions for the future. Thank you all, thank you everyone for being here today and committing yourself to this work. You know, I'll close with this story. I appreciate the work of the Cook County Department of Public Health and all of the partners of Cook County Health, Chicago Department of Public Health, and Commissioner Dr. Ige, our brand new commissioner. I thank everyone for their leadership. But I've shared this story before about my brother having untreated trauma and died addicted and unhoused. During the pandemic, my daughter, at that time she was 7, we were preparing to go back and leave remote learning and send them back to the classroom. So she was ending her first grade year in the house. And we had spent a lot of time together, and we were going back and forth. I had somehow managed to get into an argument with a 7-year-old. Which is really very humbling for a black parent in particular. And in the middle of the conversation, she interrupted me and she said, "Dad, you are triggering me." No, don't y'all clap yet. I know even white parents like, "You went too far, little girl." She has language. She has power. Her uncle that she never met, I wonder if his life would be, if he would still be here if he had that language. Let's build a better, stronger, safer system for everyone. Thank you all very much.
And now a message from the Honorable J.B. Pritzker, Governor of the State of Illinois.
Good morning, everyone. Governor J.B. Pritzker here. It's my pleasure to welcome you all to the Cook County Behavioral Health Summit. As governor, I'm committed to making Illinois the #1 state in the nation for behavioral health. Our partnership on the city, county, and state level is vital to our collective efforts as we develop a coordinated behavioral health system that is both easily accessible and equitable, attending to the cultural needs of our diverse communities. It's one of the many reasons that I appointed David T. Jones and Dr. Dana Weiner to work with stakeholders, people with lived experience, and state, county, and local leaders to realize our transformative vision for a quality and holistic behavioral health system. Behavioral health care is critical to fostering better physical, mental, and social outcomes for Illinois residents. And I'm so grateful for your dedication to improving, expanding, and advancing behavioral health care throughout the land of Lincoln. Thank you, and enjoy the rest of the summit.
Please welcome Michael Cabanargi, Region 5 Director of the U.S. Department of Health and Human Services.
Thank you. Like the mayor, I didn't really get walk-on music, so. Good morning. My name is Michael Cabanargi. I'm the Regional Director of the U.S. Department of Health and Human Services for the Midwest. That includes Illinois, Indiana, Michigan, Minnesota, Ohio, Wisconsin, and our 34 indigenous tribal nations. In this capacity, I work with our state, local, and tribal partners to address the needs of communities and individuals served through HHS programs and policies. I'd like to start off by thanking Mayor Johnson and his fantastic new Commissioner for the Chicago Department of Public Health, Dr. Ige, who we've already started having conversations with. Also want to acknowledge and thank Cook County Board President Tony Preckwinkle, Dr. Eric Makaitis, the Interim Chief Executive Officer for Cook County Health, and Dr. Tom Nutter, the Cook County Health Chief Behavioral Health Officer, and the staff of Cook County Health, who advocate every day for mental and behavioral health. What you do is truly commendable and not always recognized. For example, it's well known that County Care is the largest Medicaid managed care plan in Cook County. What may be less known is that Cook County Health provides health care for the Cook County Jail and the Juvenile Temporary Detention Facility, where more than one-third of detainees receive care for an identified behavioral health condition. The Biden-Harris administration shares your commitment to strengthening behavioral health because, it's already been mentioned, our country is facing an unprecedented mental health crisis. The crisis isn't just affecting adults, it's devastating young people, and people from every background are impacted. President Biden is committed to addressing the nation's mental health crisis. The administration has made important progress on expanding access to mental health services and invested billions of dollars through the America Rescue Plan and the bipartisan Safer Communities Act to clearly send the message, support is here. At the Department of Health and Human Services, we are proud to help lead this whole-of-society response to this crisis. We launched 988, the Suicide Prevention Lifeline, expanded mental health services in schools, advanced a Center of Excellence on social media and mental health, and launched the HHS Roadmap for Behavioral Health Integration. In addition, we've helped states to establish certified community behavioral health clinics, which provide behavioral health care 24 hours a day, 7 days a week, because mental health crises don't just happen during business hours. And we're providing hundreds of millions of dollars to programs like Project Aware, mental health awareness training, and the National Child Traumatic Stress Initiative that helps reach families and youth where they are, including at schools and in their own communities. I just want to say a word about two of these initiatives. In July of 2022, our Substance Abuse Mental Health Services Administration at HHS transitioned the National Suicide Prevention Lifeline to the 988 Suicide and Crisis Lifeline, connecting more people to care and connecting them faster than ever before. Since the July 2022 launch, 988 has received and routed 8.6 million calls, texts, and chats from people in crisis. And again, we're all about data and transparency, so we have an online dashboard. So I checked our 988 dash before I came over this morning. Last month, 988 received 507,396 contacts. That's 507,396 calls, chats, and texts in January alone from people in crisis. The average speed to answer across all the contacts received decreased from 2 minutes and 46 seconds when we first launched 988 to today it's less than 58 seconds. It's more than the enormous number of people we serve, it's the fact that we're using the data we gather through 988 to improve how we serve people who are in mental health crisis. For example, we've launched a specialized crisis support sub-number on 988 for LGBTQ plus youth. So now if people under the age of 25 who reach out to the 988 Lifeline, dial 988 and then they dial 3, they'll be directly routed to a counselor specifically focused on meeting the needs of LGBTQ plus youth and young adults. Again, we want to know the data, so the dashboard showed that last month in January, 46,130 people in crisis called, chatted, or texted this LGBTQ 9-3 lifeline. Similar to the 9-8 lifeline, the Health Resources and Services Administration at HHS has launched a national maternal mental health hotline, 833-852-6262. It's way too long. Just think of it this way, TLC Mama. Our marketing people did a good job on calling it TLC Mama. The number made no sense. Now, we know pregnancy and a new baby can bring a range of emotions. Many new moms feel overwhelmed, sad, anxious, or exhausted at different times during their pregnancy or after the baby's born. Sometimes these feelings go away on their own, but if these feelings last for more than a few weeks or make it hard to carry out daily tasks, a mom may have perinatal depression or anxiety. These are common and treatable health conditions during or after pregnancy, and that's why HHS built the National Maternal Mental Health Hotline, so a new mom or those supporting them can reach out right away for help. This hotline is also available 24 hours a day, 7 days a week, and provides free, confidential emotional support, information, and referrals to any pregnant and postpartum individual who believes they're facing mental health challenges. Once again, the Biden-Harris administration is transforming behavioral health by strengthening system capacity, connecting more people to care, and supporting the well-being of individuals by increasing healthy environments. So on behalf of HHS Secretary Javier Becerra, we appreciate today's opportunity to bring attention to mental health and how essential it is to overall health and well-being. I am genuinely excited to be here with such dedicated individuals in the room. Addressing mental and behavioral health isn't merely a healthcare concern, it's a public health imperative that resonates deeply with the core values of our nation. Thank you for all of you for what you do.
And now a message from the Honorable Dennis Deere, Commissioner of Cook County's 2nd District.
Good morning, everyone. It is such a delight and a privilege to be able to speak to you today via video. Couldn't be there in person, but wanted to say hello to each and every one of you all. I am Cook County Commissioner Dennis Deere of the 2nd County District. I am also Chair of Health and Hospitals for Cook County and Vice Chair of Cook County Health Board. Wow, lots of titles there. But one more title, for those of you who are my friends, who are out in the audience, who have been working side by side with me for the last 30 plus years in the mental health area, I'm just Dr. Deere. And so I am grateful to be here and thank you so much. I want to say thanks to a few people here. Thank you, Madam President Toni Preckwinkle, I'm sure you're right here in the room, for being a staunch leader in this initiative. You have just been a trendsetter and you just didn't start doing it. Thank you. I want to say thank you to Dr. Makaitis, who has hit the ground running, our interim CEO of Cook County Health. Thanks for all that you do. We are grateful and appreciative to you. Dr. Nutter, our Chief Behavioral Officer, new to this, but I will tell you, he is a quiet storm. Do not let him fool you. He has come in and hit the ground running and working with some of our external partners and making sure that this help. And has put together a wonderful behavioral health advisory committee that comprises of individuals from the city, the county, and the state, and other places in the county. So Dr. Nutter, thanks for all that you do. Thanks to that behavioral health, the behavioral health group that I just made mention of, that has put together and helped plan this training. Each and every one of you all in the room, I salute you. I want to say thank you to our Cook County Board of Commissioners. I know that many of my colleagues are there. Thank you all for doing the work. We are grateful to you. Thanks to my colleagues on Cook County Board of Health who do the work and sit in numbers of hours in board meetings and making sure that we are guiding our hospital in the right direction. Remember, I said this is our hospital. I want to say thank you. Lastly, thank you to my good friend, Dr. Sanders at Malcolm X. He is the president. We are grateful for your usage of this space in the 2nd County District. Welcome. Really quickly, I want to say Cook County sees mental health as not just mental health, but it is overall health. Mental health controls every aspect of our entire being, yet we have seen it looked upon as taboo. We're here to dispel those myths. We're here to help learn how we can better serve the people that we serve. Socrates said a long time ago, if you always do what you've always done, you're going to always get what you've always got. That's the definition of insanity, doing the same thing over and over again, expecting different results. This today is about us listening to each other and us learning from each other. There are no big I's and no little U's. It is us learning from each other. And my hope is that we can challenge antiquated models and really get what people need in order to get the help. Again, I am super, super, super excited. I'm not sure if you can tell, but I am excited about what's to come, what we're going to do today, but I'm also excited about what we will do leaving from them. I see us changing some things, not only here locally, but nationally, because the work is needed and the focus has not been here. We're the second largest county. So I'm looking forward to getting more involved in this work, more than I've been already. And I'm grateful. It is so good to see you all. Wish I could be right there in person. And God bless you all. Have a fantastic day. Bye-bye.
Please welcome to the stage Dr. Eric McKitis, Interim Chief Executive Officer of Cook County Health.
All right, how's that for walk-on music? Take it. Okay. Good morning, everyone. Thank you for joining us today as we kick off the Behavioral Health Summit. I'd like to thank President Preckwinkle, the Cook County Board of Commissioners, and the Cook County Health Board of Directors for being champions of health equity and access to care. Thank you as well to Governor Pritzker, Mayor Johnson, and Director Kebenarji for their participation today and their ongoing support of improving behavioral health care. Lastly, I'd like to recognize Dr. Tom Nutter, Cook County Health's Chief Behavioral Health Officer, Jennifer Brothers, Executive Director of Impact Fund and Community Services, and the entire CCH Behavioral Health team for the work they've done in putting this event together. Last year, Cook County Health established the Office of Behavioral Health to bolster our health system's mental health and substance use disorder services and partner to improve the behavioral health ecosystem across the county. The creation of this office, today's event, and the millions of dollars that will be invested in developing a more robust regional behavioral health infrastructure are supported by funding from the American Rescue Plan Act, thanks to President Preckwinkle and the Cook County Board of Commissioners. We're also developing a behavioral health community needs assessment and a workforce assessment to inform our strategic plans as we collaborate on a brighter future for behavioral health care. Behavioral health is an incredibly important topic, and having so many people here today underscores the need for our collective desire to develop solutions to this ongoing crisis. Engaging in this conversation today shows that we are stronger together. We need everyone, physicians, other healthcare professionals, social services, community organizations, elected officials, and other local leaders to come together to discuss our challenges, our successes, and what we do together to take behavioral healthcare in Cook County to the next level. It's what our residents deserve. I'm going to share some numbers. I know we've heard a little bit of statistics already, but I think it bears repeating, and this is likely not new to anyone. However, 1 in 3 U.S. adults with mental illness also experienced substance abuse disorder in 2021. That's 19.5 million individuals. High school students with significant symptoms of depression are more than twice as likely to drop out as their peers. 21% of people experiencing homelessness in the U.S. have serious mental health conditions. And people with depression have a 40% higher risk of developing cardiovascular and metabolic disease than the general population. These aren't just data points. This represents individuals who need care. It's our family, our friends, our neighbors. I have no doubt that everyone in the room has someone they know who could be represented in these statistics. The question for us today is, what can we do about those numbers? We have a unique opportunity to chart a path to real change in the way mental health services are delivered across Cook County. I'm so excited to see what comes of this event because I know we have an amazing group of passionate individuals who are committed to bettering Cook County. With your expertise and experience, I'm confident we can achieve great things in this space and improve health and well-being of the communities we serve. We're truly stronger together. Thank you for being here.
Please welcome to the stage Dr. Thomas Nutter, Chief Behavioral Health Officer of Cook County Health.
Well, first I have to say I am jealous of Dr. Makaitis' walk-up music. And thank you, Dr. Makaitis, both for your kind words and even more for your leadership. On behalf of the entire Cook County Health team, I want to begin by saying thank you to Cook County Board President Preckwinkle. Quite simply, without her strong leadership and advocacy, today's event would most likely not be happening. The office in which I am now privileged to work would most likely not exist, and the processes being set in motion by today's event would be much less likely to occur. We are deeply, yes, please. We are deeply appreciative of her efforts, as well as for the work of each of the Cook County Commissioners and each member of the CCH Board of Directors for their shared and consistent commitment to improving behavioral health care throughout Cook County. Particular thanks to Commissioner Dr. Dennis Deere, Chair of the Health and Hospitals Committee and CCH Board Vice Chair, for all your help and for your kind words today as well. Thank you, Mayor Johnson, for joining us today and for continuing to spotlight and prioritize mental health concerns, as well as for fostering enhanced city-county collaboration. Thank you, Governor Pritzker, for your remarks, and speaking of the Governor's office, thank you, Chief Jones, for all your recent guidance and collaboration and for your willingness to serve on our panel today at lunch. Thank you, Director Cabanargi, for being here and for the unequivocal federal support we've been receiving. It's great to hear the news on the LGBTQ line as well as the New Moms line. That's great news for all of us here today. Thank you to our friends at the Kennedy Forum, APS, and Wagner Lane for your partnership and hard work in putting together today's event. We made it. Thank you to our advisory council for all your wisdom and assistance, and thank you to all who are serving as facilitators today, as panelists today, or volunteering their time in any way to make today's event a success. Thank you to the UIC Door and Forum staff for your hospitality and attention to detail. And thank you to our new team at the Office of Behavioral Health. You are amazing. I know it is cliche to talk about your work group as an all-star team, but you really are amazing, and I am so excited to be alongside you to see all that will happen in the coming months and years. And thank you all for being here at Cook County's first ever Behavioral Health Summit. One final thank you. Yesterday marked 6 months that I've been at County. Prior to that, I worked at the Edward Hines Jr. VA Hospital for nearly 15 years, the last 8 of which I had the distinct privilege to serve as chief of the mental health service line there. The VA has its own systems that are resourced quite differently than the rest of our mental health systems. As such, I've been reorienting myself a bit to the non-VA behavioral health landscape. Just as a quick note, although there are some technical differences, I'll use the terms behavioral health and mental health interchangeably, and both to include substance use disorders. So in my reorientation process, it's been my privilege to go to over a dozen sites, mostly community agencies, over the last few months. These visits have left me with a few thoughts, maybe an insight or two, and one overwhelming feeling that supersedes all else. That is deep gratitude for the work that you do every day. I wish I had a better word than inspiring, but know that you inspire me and that you inspire our entire team. The work you do every day is far from easy, and it's even farther from being glamorous, as you well know. There are certainly easier ways to make a living. You make extra phone calls or visits at the end of the day because you're worried that your patients with past psychotic episodes missed their injections today, and you're concerned. You schedule extra time to meet with teenagers going through chaotic family events to try to keep them from becoming statistics. You walk around in sub-zero weather to be sure unhoused individuals have shelter. You work tirelessly to be sure your non-English speaking clients can talk about their traumas in their native language and with someone who understands their culture. You take extra time to be sure residents returning from carceral settings have housing, some job prospects, and hope. And the list could go on, and as you know, it goes on and on. You face burnout not just because you work hard, which you most certainly do, but because your work regularly places you squarely in the places in which our systems are most broken. There are days I'm sure you wonder if you're really making a difference. I'm here to tell you that you absolutely are. And I know you don't hear thank you nearly as often as you deserve. So I want to start today by saying thank you for what you do. I don't use the term hero lightly, but you are truly heroes, and on behalf of the citizens of Cook County and on behalf of Cook County Health, thank you for what you do. I know if you hear nothing else that I say today, please let it be that. I know you won't want to give yourselves a round of applause. Please give a round of applause for everyone else at your table and the incredible work that they do day after day. My wife, who was born and raised in Cook County, and I moved here in the summer of 1996 for me to begin psychiatry residency. We've been here ever since, and I've recently been thinking quite a bit of all that's happened over those years. As I think about my professional life, it's clear that there are ways in which mental health care is better than it was then. For example, we were just starting to use second-generation antipsychotics then, and just starting to learn how to dose first-generation antipsychotics. So there are a lot fewer people now who have tardive dyskinesias. We have more medications, we have more modalities of care, and hopefully more medications and modalities of care coming up just in the next 2 or 3 years. We have a number of new evidence-based psychotherapies that weren't in existence for specific conditions that did not, these therapies that were not in use when I was in my residency. And stigma in general has diminished considerably in some respects, particularly in young people, since I began my training. But we all know stigma is alive and well, and in some groups it seems barely to have diminished at all. In fact, as I think back on the last nearly 3 decades, in many ways it feels like we've lost ground and continue to lose ground. For example, every time I've seen population projections regarding mental health supply and demand, particularly in outpatient settings, the story is essentially the same. Again, this is for the last decade. Supply, that is the number of clinicians available to treat mental health conditions, has been increasing and continues to increase gradually and slightly. Mental health demand, however, continues to increase much more than slightly, so that with each year that passes, the gap between what is needed and what is available has been growing wider and wider, a trend that was only exacerbated and accelerated by the pandemic. Suicides have been gradually increasing in frequency over the past quarter century. Deaths by overdose have increased 6-fold since I graduated from residency in the year 2000. According to SAMHSA's 2022 National Survey on Drug Use and Health, 49% of young adults had a diagnosis of a mental health condition or substance use disorder in the past year. More than 13% of our adolescents experienced serious suicidal ideation in the previous year. Think about a typical high school full of classrooms. That's on average 4 kids, our kids, in every one of those classrooms. And for those needing care, as was mentioned by President Preckwinkle, 40% do not receive care, nearly 50% of adults do not receive care, and among those with substance use disorders, 76% did not receive care. But the percentage of people receiving treatment doesn't even tell the full story, because it doesn't measure whether the care rendered was the right care or the best care. A nationwide study of the treatment of major depression a few years back found that less than half of those receiving treatment received treatment that was concordant with national guidelines. And the percentages receiving guideline and concordant care among Black and Brown populations were even lower. As many of you know, close to 2,000 Cook County residents lost their lives to opioid overdoses in 2022, and the numbers will be about the same in 2023. Though the highest number of deaths statewide were among whites, per capita rates in the Black population, particularly those in middle age and older, are considerably higher. In fact, about 6 times higher than the state's average per capita rate. I've rattled off quite a few facts and statistics, but we all know that suffering cannot be described in statistics. Every one of us carries stories. Some of us carry lots of them, professional and personal. And the true cost of our mental health crisis is immense, it is incalculable, and as we all know, it is heartbreaking. There is much to be discouraged about and much to even be overwhelmed by. Yet this is a time of unprecedented opportunity. I don't believe there's been a time in the past 3 decades, probably ever, when the need for mental health care has been more widely appreciated from everyone in all all parts of our country, everywhere you can imagine, because there's now virtually no one anywhere whose life hasn't been touched in some way by behavioral health concerns. There don't seem to be many ways in which the vast majority of people are rowing in the same direction these days, but the desire to improve mental health care appears to be one of them. This is also a moment where there is a strong desire for collaboration among organizations providing mental health care and other social services. Given the growing number of people needing services, there's almost no need to compete for clients. And though there will always be some competition among organizations for resources, I think many agency leaders are now would say that collaboration is often more helpful in obtaining those resources than is competition. Yeah, please. Think about today's summit. Because of the realities of the grant funding cycle, we had a fairly truncated timetable to put all this together. As such, there was no advertising blitz. Our email list was inadequate. Our day has been opened by very distinguished speakers who I'm honored to meet today. But we don't have a famous athlete or celebrity coming in the middle of the day. There are no CEUs being offered today, no CME. It's an all-day event. It's February, and it's Chicago. And despite all that, in less than 2 weeks, after more than 725 people registered, we had to close registration. Yes, go. I've been joking that we're the rock star of behavioral health summits in that regard. We sold out so quickly. This is also a time of unprecedented political will for improved mental health care, and as evidenced by the speakers who preceded me this morning, growing collaboration among all levels of government toward that end. And where there is this much social and political will, there is funding, and likely to be more of it in the next few years. None of us know the future. We don't know how long this window will remain open. We don't know how wide this window will open, but we cannot squander these opportunities for thoughtful investments into our systems of care and into strategies for improving the mental health and well-being of Cook County residents. I'm not one given to grandiose pronouncements, but let this day be recorded as the day more than 300 organizations from throughout Cook County came together to make things better in ways that will be making a positive impact a generation from now. How will we go about making these changes, and what will the role of the Office of Behavioral Health be? We don't yet fully know how things will evolve, but as mentioned by Dr. Makaitis, our office was created not only to improve CCH's internal systems of care, but also to improve the behavioral health landscape throughout Cook County. CCH would like to take greater responsibility to help as a convener, as a land bridge across organizations, as a source of information, as an architect for systems alignment, and as a voice for equity. We are a fairly small team at present, but a team with diverse expertise, a strong work ethic, and a collaborative spirit. I know this, and you know we all have certain things we say over and over. This is one of mine. When problems need to be solved, all of us are smarter than any of us. I will add, when advocacy is called for, all of us are louder than any of us. And when there is adversity, and there's certainly adversity, all of us are stronger than any of us. We are indeed stronger together. So that was a lot of words. Why are we here today? What are we doing exactly? First of all, what we will not be doing. Today will not be a day of sitting and passively absorbing information. Today is a day of structured listening, a day focused on gathering perspectives and ideas from everyone here on where we go from here. Some of that structured listening will be via surveys. There'll be more than one survey. Some of it will be via discussion and collaboration with colleagues. Some will be relatively high-tech, some definitely low-tech. Some will be kind of fun. We have the person on the street interviews and the board outside and all of that. But expect to be asked for your perspective and expertise, both professional and lived expertise, a lot today. What will be done with all that information and perspective? The insights being gathered will be used for two things. The lesser but more immediate of the two will be to inform our impact fund grant making. We have more than $40 million in American Rescue Plan dollars to award, and an open call will be announced in about 3 weeks. Perspectives gathered at today's event will inform how this open call is structured and eventually how these funds are spent. We want to be good stewards of every dollar we're entrusted with, and to do that means hearing from as many representative voices as possible prior to crafting of the RFP. On a larger scale, information and perspectives gathered today will inform countywide strategic planning processes that will be completed by this fall. The resulting strategic plan will be a blueprint for addressing inequities and gaps in care, avoiding redundancies, improving systems alignment, expanding our workforce, enhancing prevention and early intervention efforts, and augmenting advocacy in the coming years. We're hoping that 2024 could be a year of planning so that year 2025 and 26 will be all about implementation. So how will today be structured? Let's see if we have, looks like we're having a technical issue here. So someone may need to assist with putting up the slides. Oh, it's up, okay. But do I have control of it? I do not. All right, so we'll do the advanced slide, please. If somebody can somebody advance the slide? I'm good, okay, perfect. The main focus of today will be on the 3 breakout sessions. After brief introductions in each session, these will be set up to gather your feedback. The first 2 rounds will be topical, and the third, which may be, in my mind, the pinnacle of the day, will be by region. We also have what I think will be an informative, thought-provoking panel discussion during lunch, hosted by CCH's Chief Equity and Inclusion Officer, Shannon Andrews. Included on that panel will be Jennifer Brothers, our Executive Director of the Impact Fund I mentioned earlier, and Community Services. So there will be a bit more discussion on that topic. She will be joined by some of our partners and new partners regarding the use of data, community engagement, and partnerships to build a more equitable behavioral health system. I'd like to say a little bit more about the breakouts, review some maps to sort of prime your idea pumps a little bit, and then go over a few housekeeping items. We chose 3 main areas of focus for the topical breakouts: crisis care continuum, treatment, recovery, and support services, and prevention, early intervention, then divided these into more specific topics for each. Since systems of care and workflows for youth and families are often distinct from those serving adults and older adults, we made them separate sessions. Some may ask why certain topics, such as treatment of substance use disorders, or integrating systems of care, use of technology, or addressing trauma in those proximate to violence, don't have separate sessions. And the reason for this decision was that in discussion with our advisory council, it was felt that these topics are so crucial that they should be discussed in all breakouts rather than just 1 or 2. Regarding the regional breakouts, can you go to the regional slide? Oh, there we go, okay. We used the already established 6 health equity zones for Chicago and then divided suburban Cook County into 4 regions. And a number of folks who in their registration indicated that the organizations they serve the entire county. So that's 11 groups and 6 breakout rooms. So I just want everyone to know that the way the groups are broken down is strictly by numbers. There's no other logic to that. So I just wanted to dispel any rumors before those could begin about any preferential treatment of any one region. In the interest of getting you warmed up a bit prior to the breakouts, I'm going to quickly run through some heat map slides. First from the Chicago Health Atlas, and then also from the Cook County Health Atlas. These are available online, easy to find. Just if you can remember Atlas and Cook County and Atlas and Chicago, you can find these easily. There are a lot more maps there, and all the data that feed those maps. It's a treasure trove of information. So this is the social vulnerability. Okay. I won't be able to point, so hopefully folks can see where they are on the map and where your regions are. This is social vulnerability, which is a set of measures designed by the CDC to determine which communities in the event of disasters are most vulnerable. It involves factors with income, employment, housing, transportation, and the like. These are the data for Chicago, and it may be challenging. At the top corner there is Rogers Park. You can see O'Hare is that big blob off to the in the top left there. In the middle there, Austin. Further south, you can see. Well, I can't point to the things anyway. You guys know where you live. This will be a little trickier than I planned here. And just so you know, where you can faintly see the word Chicago there, that's the loop. So probably not a lot of surprises on this map. Let's go to the next one. This is suburban Cook County. It turns out that there are 133 municipalities in Cook County besides Chicago. And the colors used here are a little different. Here, the more concerning is the red. The areas of lesser concern are more in the purple. It's a different color scheme than used in the city maps. You can see up to the top left is Glencoe, far out to the west, Elgin. That little kind of rectangle to the southwest is Lamont. And you can see a little bit more, a little more speckled pattern here compared to the city map. Let's go to the next slide. This is a redlining map circa 1940, and I simply show this as a reminder to all of us that that social vulnerability did not happen by accident, but was a result of systemic racism. Moving on to the next slide. This is psychological distress for county. Again, you'll see a little bit more speckled pattern, though, with some areas of higher concern there, west, southwest, and south, but really even a couple patches there up to the north. Next slide. This is unmet need in the city, and you can move on to the next slide. This is the more telling one. This is, this is unmet need for those with high psychological distress in the city, and what you can see in the numbers, which is also sort of reflected well on the map, is that 8 of the 9 highest areas of unmet need are on the south side. Next slide, please. This is behavioral health hospitalization rate. You'll see a particularly high density on the west side, to a lesser degree south side. This is largely a measure of most likely what is insufficiency upstream of hospitalization. It certainly doesn't mean that there's more mental illness in those areas than other places in the city. Next slide, please. These are the county data, also looking at hospitalization rates. You can see slightly higher rates in a few spots there, but in general, again, a little less variability than you see in the city data. Next slide. Okay, this is, sadly, this is drug overdoses, which are high throughout. Some of these data are a little older, but you can see a particularly high density on the west side and in particular, and in a lot of neighborhoods on the south side, but really, obviously, this is a tragic thing all over. Next slide. This is drug overdoses in the county, and you'll see a lot of missing data here, but you'll also see that there's particularly high rates of overdose. The red to the west there is Maywood and Broadview, and then to the south, that's Harvey, I believe. Next slide. This is an interesting slide, given all the discussion recently about how much of all the health risks of loneliness. These are ratios of adult loneliness, and I should have said earlier that the more concerning areas on the city slides are the darker blue, and the lighter green are the areas of lesser concern. So you'll see here a pattern that's very different than the social vulnerability index data, indicating that some of the communities that may have higher social vulnerability may also have higher social connectedness to build upon, which is a great thing. But you can also see in some of the areas that may be more economically well off, there may be some significant challenges in social connectedness in those kind of resources as we plan improving systems of care. Next slide. Okay, and this is Medicaid, the number of Medicaid providers. These are city data. This is actually the opposite of all the other slides, because in this particular one, the light green are the areas of most concern. And you'll see particularly in pockets on the to the northwest and southwest in the city, particular dearth of clinicians. Next slide. This is probably the most I think this is the most dated of the maps. It's 2011, but this is also a case where the map sort of buries the lead, because what you can't tell on the map here is that for more than half of Chicago's neighborhoods, the number of psychiatrists per capita is 0. The next slide, please. Okay, this is mental health providers in the county data. You can see that there's actually, we're doing relatively well, far northwest and far north, but again, more kind of a speckled pattern throughout the suburbs, throughout the rest of the suburbs. Next slide. In a related story, this is the percentage of people who say that their mental health was not good for more than half of the previous month, and you see some connection with the, some correlation with the previous slide. Next slide. This is the framework document. You received this in an email you got. You should have gotten yesterday. A lot of us see problems visually, and I think that when you look at this, you can see various aspects of our systems of care, and then can sort of look and visually see where we might intervene. And I do encourage everyone to look at the full document in your that was attached to the email. So lastly, let's go ahead and leave that up. So a few housekeeping things. Space is limited, so please do go to the sessions that you're signed up for. The rooms are a certain size. We have a certain number of registrants for each room. So if you go to different sessions, there will be a little bit of chaos there. So very much appreciate everyone's doing that. Masks are available throughout, as no one wants to talk about COVID, but there are masks available and should be available outside the rooms as well. And lastly, there's a caveat to all of us are smarter than any of us. It's only true if everyone's perspectives are valued and heard. In the spirit of Abraham Lincoln, which is appropriate this week, given that it was his birthday and Abraham Lincoln himself had severe depressions with suicidality, let's listen to the better angels of our nature today. And what I mean by that is when we're in the sessions, the breakout sessions, there are a number of us that are very enthusiastic about the organizations for which we work, and there are some of us with letters behind our name who often are treated deferentially and allowed to speak more. So please do remember when you're at the table to let everyone's perspectives be heard. In a room full of this many mental health professionals, I'm confident that will not be a problem. So thank you very much for your attention. Let's dive in. Let your voice be heard. Thank you. Stand by for more direction on where to go next.
Hi, everyone. How are you? My name is Rachel Hogue. I'm with APS and Associates. Thank you. I'm part of the planning team for today's event, so thank you again. I have a couple reminders